So if there was just 3 take-home messages that you would like our listeners to leave with, what do you think are your 3 main take-home points from this talk?
I guess I think the first thing to say is that the steroids in septic shock has been one of the hotly debated topics for nearly 60 years. And I think we probably have very reasonable evidence that low-dose corticosteroids are beneficial in patients with septic shock, in improving shock reversal and in weaning from mechanical ventilation. Their role in mortality still remains unclear. We also now have clear evidence that biological mechanisms are at play and possibly genomic mechanisms determine which patients will respond to steroids and who won't. And I think there's a lot of work being undertaken in this area. And I think the next 5 to 10 years, I think genomic tests, possibly bedside tests, will be available to as point-of-care testing, which might actually help determine which patients should be assigned to corticosteroids and who will not benefit from corticosteroids. I think the final question really is a fludrocortisone question, and I think a randomized controlled trial will be necessary to determine comparing hydrocortisone versus hydro plus fludrocortisone in determining if it's beneficial or not. So I think these are 3 important messages. Yes, hydrocortisone can be used. Genomics will, in the next 10 years, will tell us who will benefit from hydrocortisone more precisely, and the fludrocortisone question is still open.